Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Health, and today is another episode of Dr. Trudy Open Clinic. This evening, we're going to talk about menstrual cycle and understanding the whole package of your menstrual cycle and the best way to become pregnant when you've understood your menstrual cycle. So thank you and welcome to the clinic today. In like 30 minutes, we're going to discover what we need to do, what we need to be conversant with the female reproductive system, paying special attention to the menstrual cycle. So you're going to understand what your menstrual cycle is all about. You're going to be conversant to what you need to look out for. Then at the end of the day, you're going to find out the steps which you need to take so you can become pregnant fast. So without wasting much time, we're actually going to start because we have a lot of important things to talk about. So when we talk about menstrual cycle, this is actually a monthly hormonal cycle that controls everything that happens in the body of a woman. So it's a monthly hormonal cycle of a female's body, which in preparation to becoming pregnant happens to every woman. So the global aim of every woman every month is to become pregnant. Now your cycle begins from the first day of your period or from the first day of your menstruation. Now it begins on that first day and ends on the beginning of another one. Now throughout your monthly cycle, your body keeps making large amounts of important chemicals we call hormones. These hormones are the chemicals that will control everything that will make you a mother. Now, I'm going to mention the important female reproductive hormones that will control your menstrual cycle. Number one is estrogen. Number two is progesterone. Number three is FSH, follicular stimulating hormone. Number four is LH. I'm actually going to stop at these four basic reproductive hormones. So every single month in the body of a woman who is still within her reproductive cycle, all these four hormones will come together and control the body. Now, I want you to pay attention to two different phases in the cycle, the follicular phase and the luteal phase. The follicular phase is more like the building phase. The luteal phase is the consolidation phase. Now, in the middle of it all is where you have your ovulation. So during the monthly cycle, I want you to pay attention to an important event that happens inside the womb. You see, like I told you, the body of a woman, the womb is programmed to become pregnant every month. Now, by the time you're bleeding from the first day, what are the components of that bleeding? Failed ability of the womb to receive a pregnant fetus. So the cover of your womb will disintegrate. The cover of the womb is called the endometrium. It's going to break down with tissues and blood, and it will be passed out as blood. This is pretty much what happens when you bleed. Now, shortly after your bleeding, you are now going to start preparing the body. You are now going to start having the chemicals, which is called hormones, come to the ovaries to prepare another important vehicle we call the follicle, which will contain another egg. So it's expected that in a woman that has a 28-day cycle, just right in the middle, on day 14, those eggs that are growing, one will be big enough to be released through the process of ovulation. Now, what actually leads to bleeding when there is failure of pregnancy is low level of estrogen and progesterone. So once pregnancy has failed, generally the body will start producing less estrogen and progesterone. And once you have fewer estrogen and progesterone, you are going to initiate bleeding. Now, it's expected that as you're getting older, your cycle will keep fluctuating. The normal cycle is 21 to 35 days. So if you can pinpoint that every 21 days you bleed, that's your normal. If you can pinpoint that every 35 days you bleed, that's your normal. A typical cycle, which is commoner out there, is 28 days. But not every woman will have 28-day cycle. Some will have 21, some will have 26, some will have 35, and some will even have higher numbers. Once your cycle goes above 35, then it's considered irregular. Your cycle might also fluctuate within a particular woman from month to month. So in a particular month, your cycle might be 28. In the upcoming month, it might be 29, it might be 30. But the key word is to make sure that the fluctuations are in the same range. So you want fluctuations that will be around 28, 29, 30. And you want fluctuations that will be around 21, 22, 24, because you can easily find the average and it will be your number. So it's not every woman that will have an ability to predict exactly when she will bleed. But some women are so regular that they can predict the day and the time their period will start. Some other women might not be lucky, but they might just have an idea of when they will likely, bleed. Now, what's your bleeding? What's the menses? Like I mentioned, is the monthly bleeding. It's called your period. It's composed of decomposed blood, breakdown of tissues that was getting ready to receive the pregnancy. Once it doesn't happen, the blood, the tissues will flow out from the uterus through the vagina. That's simply what your bleeding is all about. That's simply what menses is all about. Now, how does your cycle change as you get older? So it's expected that as you're getting older, your period will start thinning down. Now, when you are just about starting your period, it's normally heavy. So women that are in their teens will likely have very heavy bleeding. Now, as you're getting older, as you're getting into 20s and 30s, it begins to be lighter. Now, for a few periods after your first period, it's not unusual to have about 38 days or 40 days is expected at the two extremes. Now, in your 20s and in your 30s, that's when you have the best chance of becoming pregnant. Within this period, it's expected that your cycle will be within 24 to 38 days. It's expected to be normal. Now, when you enter your 40s, your body begins to get ready for menopause, and your cycle will start dwindling. Some women will reduce from 7 days to 4 days. Some women will reduce from 4 days to 2 days. It's still normal. Some women will discover that their bleeding is lighter. It's no longer heavy. That's a preparation towards going into menopause. When you go into menopause, you will no longer bleed. So if you notice that you're in your 30s, but you don't have a regular period, or it's heavy or it's extended, it's time to call your doctor so we can know what to do to help you understand what's going on. Now, why should you track your cycle? What are the 4 reasons why you need to track your cycle? Number 1, if you track your cycle and your period is regular, tracking it will help you to target when you ovulate. If it's regular, you apply factor 14. So assuming it's 28 days, if you track your period, on the 14th day is when you will ovulate. If you want to get pregnant, you can make love about that time and you can become pregnant. You can also use it to check your fertility window. Now, when you track your period too, if it's irregular, it will also help you to tell your doctor when you go for your visit how irregular it is, how light, how heavy. Now, if you have period pain or excessive bleeding, or you bled so much that you couldn't go to work, you missed school, it's also important you know about this, because the likelihood you might have some gynecological problems like polyps, like endometriosis, like fibroid will be there. Now, if you experience sudden severe bleeding or sudden severe pain, which you were not used to before, it might also be a sign for us to keep an eye on your cycle to know what's going on. Now, how can you keep track of your cycle? There are so many apps there. But remember that the first day of your cycle is when you bleed. So I want to encourage you to form the habit of tracking the pattern, tracking the changes. You can get a calendar. You can put it in your phone. The first day of your bleeding is the first day of your cycle. So you can just take care of this, put it somewhere so you can use it to know how regular you are. Now, you might also want to track your symptoms. Some women will develop what we call premenstrual syndrome, PMS. So within this period, you're about to, bleed or have a particular thing happen to you, you begin to experience cramping. Some women will have what we call mid-cycle pain about the time they are about to have their period. Some women will notice they have headaches. They are very moody. They are forgetful. They are bloated. The breast is tender. You can track all this. If you pay attention, the body of a woman is like a clock. Now, some women will also track when the bleeding becomes. They will know if it's early, if it's later. You will also know if it's heavy, if it's lighter. You know the heaviest day. You know when to know how to go to your doctor. You know the number of parts you used to change, and suddenly you're changing more, or suddenly you're no longer changing. Some women will come in and say, oh, doc, my period is just dropping. So when you're tracking your period, you can track the symptoms. You can track your pain to help you know where you fit into the whole bigger picture. And you can also check the number of period or number of days you bleed. The normal bleeding day is 2 to 7 days. So if you notice you're bleeding for 10 days, there's a problem. If you notice you just bled for 1 day, there is a problem. You call your doctor, we begin to monitor to see if we can discover what might be causing the problem. So this, in a nutshell, it's the basic info you need about your cycle. Now, if you are younger than 35 and you know you are 28-day cycle and you know you can pinpoint when you ovulate, if you make love around your ovulation and your fertility window, all things being equal, your partner's sperm okay, you're going to get pregnant. Now, if you are above 35 and you notice you're not regular, you will also know how to apply PPP, because the older you are, the fewer the number of quality eggs you have. So when you know all this, you can know when to apply more pressure. You can know when to apply more action. So knowing your body, knowing if you're 28, knowing if it's mid-cycle pain, knowing if it's ovulation, knowing your best fertility window, knowing the least time you might avoid pregnancy. When you apply this, when you study your body, when you discover the abnormal, you can begin to seek help. Unfortunately, some women might notice something, but because they are not paying attention to their body, by the time you know it, it's already late. So pay close attention to your body. If you can pinpoint the exact time, the function of progesterone, the function of estrogen, the function of FSH. Some women also go for ovulation test kit. When you're using your ovulation test kit, what are you checking? LH, luteinizing hormone surge. Because when you are about to ovulate, the level of your LH will go up, and within 24 hours, you ovulate. So if you know all this, you and your partner can plan your family and get busy, and in 2022, you're going to become a mother. Okay, so I'm going to start taking care of your questions, and please feel free to ask your questions in real time, and I'll provide you feedbacks. So the clinic is open. Feel free and ask your questions. If today is the first day of attending the clinic, thank you so much. I appreciate you. Please take note of the subscription button. Subscribe, click on your notification, like, share with your friends, make out time to go through the previous videos. There are so many important videos that will help you to understand your body better. But right now, the clinic is open, and I'm ready to take care of your questions. So please feel free and ask your questions in real time. Okay? If you have any question, please feel free and ask, and I'll provide you feedbacks. Do we have any question, please? Feel free. Okay. Can a woman ovulate twice in a month? The answer is yes. In some women, if they have a relatively short cycle, they can ovulate twice. So it's rare, but it can happen. So if your cycle is towards 20, lower 20s, you can ovulate very early in the month, then later in the month. So the answer is yes, it's possible to ovulate twice in a month, though rare, but it can happen. Okay? All right, please keep asking your questions. If you have any questions related to this topic, feel free to ask. I'll provide you feedbacks. Even if your questions are not related to this topic, don't worry. Go ahead and ask. This is an opportunity. Our next clinic will be on Saturday. So please keep a date with us on Saturday. Now, if because of time you missed our Tuesday's clinic, I understand it's very late in so many locations. When you wake up in the morning, you can review. It's still going to be the same information. But right now, please keep asking your questions so I can provide you feedbacks. Okay? Okay. Hello, doc. What about women with PCOS? How can they become pregnant fast with irregular or no periods? So one of the problems we have in polycystic ovarian syndrome, which is PCOS, is a known factor that can affect female infertility. The biggest problem in polycystic ovarian syndrome is lack of ovulation. So there are modalities for taking care of that particular situation. Number one, early diagnosis. PCOS is not a straightforward diagnosis. So if you've been wanting to become pregnant and you notice some changes in your body, there are a couple of presentations of PCOS that might be a telltale sign. Suddenly you're growing hairs. Suddenly you no longer, bleed the normal way you're supposed to bleed. Suddenly you're adding weight, despite the fact you've been doing the right things, you're eating clean, but you're adding weight. You are moody. You're just not yourself. When you find yourself in this boulevard, you book an appointment to a gynecologist. Then we begin to hunker down to make diagnosis of polycystic ovarian syndrome. Diagnosis of polycystic ovarian syndrome will involve three modalities. We ask you a couple of questions, we examine you, we look at your hormones, then we go to your ovaries to see the nature of your ovaries. In polycystic ovarian syndrome, when we go to the ovaries, we see multiple fluid-containing cysts, which will affect ovulation. So the most important problem in polycystic ovarian syndrome is lack of ovulation. And if you can't ovulate, you can't become pregnant. So how can we take care of this? We are likely going to give you some fertility treatment. Now, because some women that have polycystic ovarian syndrome will have insulin insensitivity, we are also going to give them some drugs for treatment of diabetes. Now, besides that, you have to keep a healthy lifestyle. So you should exercise, because we notice that women that have polycystic ovarian syndrome, when they reduce their body weight, they increase their chance. So the overall aim of polycystic ovarian syndrome is to get your body weight to the normal, to make sure your ovaries are challenged. So if you still have eggs, we're going to give you ovulation induction drugs so you can release those eggs. So the management of polycystic ovarian syndrome is a stepwise, careful process. So when they are giving you Clomid, are giving you metformin, make conscious effort as a lady to lose your body weight, stay active, eat healthy, avoid stress, so that when you get yourself in a good place, nobody can lose your body weight. You can have the best doctor in the world. If you don't lose your body weight by your lifestyle modification, then you're going to delay yourself. So very important stepwise process of managing polycystic ovarian syndrome. Can a woman with long cycle track her ovulation with her ovulation predicting kit? Now, remember, the problem with long cycle, it's the possibility that it's irregular, right? Now, when your cycle is off key beyond 35, below 21, it's normally difficult. At that stage, the tools you might need might actually be a blood work from your doctor. So there are a couple of blood works, there are a couple of hormones you are looking out for to make sure the woman is ovulating, because some people might have the physical, non-specific signs that they are ovulating, but in reality, they are not ovulating. Now, if your cycle is long, it might not give you a reliable indices in regards to tracking your ovulation, especially if you're above 35. So if you're above 35 and you have longer periods, so what's longer period? Beyond 35. Or you have shorter period, below 25. The normal cycle is 21 to 35. If you find yourself in this juncture, you need to go and see a gynecologist. Sometimes we'll give you some regulatory drugs to track and monitor your bleeding. Then we begin to place you on some hormone treatment if need be. Using your ovulation predicting kit is going to derail you. It's not a hard and fast kit. Some people might think they are ovulating in that kit, but behold, are not ovulating. So you need to meet with your gynecologist, possibly with a fertility specialist. Okay? I love that question from Kenneth. Okay, why is there a low risk of pregnancy while a woman is on her period? Very, very smart question. Now, remember what happens when you're in your period. There is breakdown of the cover of the womb. Estrogen is low, progesterone is low, pregnancy didn't happen. The cover of the womb, which ordinarily implantation would have happened, then the baby will start developing. Two hormones must sustain your pregnancy, progesterone and estrogen. So when you are not pregnant, the cover of your womb will disintegrate. That's simply what bleeding is all about. So the possibility you will have an egg when you are bleeding, it's almost zero. But we don't use never in medical practice. Now, there is a pathway for you to become pregnant when you make love during your bleeding. But it doesn't mean you released an egg during your bleeding. It means that shortly after you stop bleeding, you release your egg. So if you have a short cycle, remembering that the sperm can live in the body of a woman for 5 days, sometimes 7 days, if your partner makes love to you during your bleeding, assuming your partner made love to you 2 days to ending of your bleeding, and shortly after your bleeding, you release your egg immediately, you can become pregnant. But you do not release your egg during your bleeding. There is no ovulation when you're bleeding. So women that became pregnant when they made love during their bleeding, it's because of timing. It's because of early release of the egg after your ovulation, after your bleeding. So very, very important. So it's mainly governed by the level of hormone in your body. So it's not unusual to hear that, oh, a woman became pregnant because she made love during her period, which is very difficult to prove anyway. So the mechanism that will get her pregnant, it's not because she released an egg during her bleeding. The egg was released shortly after the bleeding. Okay? The best time to become pregnant in a woman's cycle is the fertility window. So your fertility window opens 5 days before your ovulation and closes a day after your ovulation. This period of 6 to 7 days is the best time for you to become pregnant. Now, if you are above 35, we don't preach ovulation sex, we don't preach fertility window sex, we preach 48-hour sex. Now, if you are younger and if you have noticed that you have a particular pattern which you can predict, now fertility window and ovulation might work for you because you're younger, you have more eggs, you might have more quality eggs, your fertility index is high. But once you get to 35, your fertility is dropping, so you don't practice ovulation sex, you don't practice fertility window sex. You just do what? You just have sex 48 hours. Okay? All right. What are the things that can kill sperm in a woman? Now, sperm is very sensitive. Okay? Now, if a woman's body is toxic, if a woman's body has a lot of toxins, a lot of chemicals, like there are so many women that put a lot of things in their body that will damage your body. Now, also, some women might have anti-sperm antibodies. So some women might have hostile cervix. When the sperm is about to come into the cervix will tell the sperm no. It will start attacking the sperm. It will start destroying the sperm. Few, rare, but it can happen. But generally, the way God structured the body of a woman, once you are able to start bringing your family, the cervix will be friendly, the vagina will be friendly, the sperm will go in, they know how to get to the tubes, they know what they are looking for. But some women might be predisposed to having this problem in a situation where the cervical mucus, actually the cervical mucus is supposed to feed the sperm, give the sperm nutrients until the sperm gets to the tube. So this is where you need to be careful with your care of your vagina, because some women put a lot of foreign things in the vagina, increasing the toxicity level there, and it can affect the function of the sperm. Okay? All right. What are the things that can kill? Okay, I've already answered that. Okay? Your last period was 29th of last month, and it lasted for 3 days. Where can you ovulate? Now, admin, I don't know if you have access to our calculating ovulation. So my sister, I want to tell you what you need to focus on. One date. What I want you to do is to track Okay? So if your last period was on the 29th of last month, that's October, right? Now remember that your cycle starts from the first day of your bleeding. Now, what I want you to do, I want this to be practical, right? So go to your calendar, mark 29th of October. Okay? Now, how many days? You bled for 3 days, right? So let's do some mathematics. 29th, okay? Then November 1st, November 2nd. So if we are using the data you gave us, sorry, I made a mistake. If we are using the data you gave us, 29, 30, 31st, right? So from 29, 30, 31st, that's your 3 days. But you start counting from 29. Okay? So you take care of 29. You mark 29 down in your calendar. Now you focus on November. When you bleed again in November, you mark that date. So let's use a tentative date. Your first bleeding in October was on the 29th, right? Now in November, you started bleeding on 25th of November. Now the distance between 29th October and 25th of November, it's your cycle. So let's throw in a number. Let's say it's 29 days. So if the interval between October and November is 29 days, you are a 29-day cycle woman. Now, how can you know your ovulation? You bring in your factor 14. Okay, so since you're 29 days, when you minus 14 from 29, you're going to have 15. So if you start counting from the 29, 15 days from 29 October, exactly about that time is when you have your best chance. So if every other factor in your body works okay, on that 15th day is when you will ovulate. So the key word is to know the first day of your bleeding. Mark it down, then start thinking about the upcoming month. Find the days between them. Then apply your factor 14. If you have a regular cycle, so if you are bleeding every 21 days or every 35 days, you can apply factor 14. Once you are outside these two ranges, you might not be able to get good calculation with factor 14 because beyond 21 and 35 days, things become what? Irregular. Okay? So go home and try this. You do better when you practicalize certain things. So ovulation is one of our most, talked period, stuff in this group. We have sang it like, national anthem, so you should know it. So go and practice. Mark 29th, then wait when you will bleed in November, then find the average, then keep an eye on December. Okay? All right, let's see. Okay. When should you take a pregnancy test? This guy, I've already told you, you're going to be a doctor. Now, this is what you need to do. You see, that particular period you are anticipating for your period to come, right? Now, let's use example. Today is the 2nd. Assuming you were anticipating that your period will come out tomorrow, being the 3rd, please don't go checking anything. It's too early. Allow 7 days. So tomorrow being 3rd, if you add 7 days to 3rd, on the 10th of November, if you still haven't bled, go and run your pregnancy test. By the grace of God, you're going to become pregnant. So 7 days beyond your anticipated bleeding, if you miss your period, allow 7 days. When you allow 7 days, you will have adequate quantity of beta HCG, the so-called pregnancy hormone, in your urine and in your blood. When we measure that, we will find that it's increasing every 72 hours. So 7 days beyond the period you are anticipating to see your period. If your period doesn't come, 7 days, go and run a urine pregnancy test. The problem is most women check very early and they give up and they cry and they begin to have a lot of anxiety. Some of them might be pregnant. But when you're increasing the level of anxiety in your body, you are not helping that pregnancy because the body of a woman is structured. Anything that disrupts your body can affect your cycle. So 7 days beyond your missed period is the best time to check for pregnancy test. Very, very important. Is low progesterone a cause of miscarriage? Yes. is a risk factor. It can play a big role. Let me tell you why. Remember, if the sperm gets to the tube and fertilizes the egg, they will come back to implant in the womb, right? Now, an important hormone that will prepare your womb for implantation is what? Progesterone. So if you don't have adequate level of progesterone, you will not have adequate thickness of the endometrium. Endometrium is the cover of your womb. When you don't have adequate thickness of the endometrium, what's going to happen? You will have weak endometrium. So you might be pregnant, everything might be going okay, but you do not have good foundation for your pregnancy to strike. Before you know it, the pregnancy will disintegrate. So low progesterone has been found to be a major player in majority, if not all women that had miscarriages. So if in course of investigating your miscarriage, remember that miscarriage is unintended loss of your pregnancy before 20 weeks. If it happens beyond 20 weeks, it's called stillbirth. Most women that have miscarriages, we notice they have low progesterone. What do? We give you progesterone supplement. So once you have had miscarriage, we need to investigate. Don't be in a hurry to become pregnant again. We need to run your hormone profile test. When we discover that your progesterone level is low, we supplement you with progesterone. Some women, their progesterone level will be normal, and we still give them progesterone because it's meant to protect that pregnancy. Okay? Very important. There are 4 important hormones you need to be conversant with: estrogen, progesterone, FSH, and your LH. LH is luteinizing hormone, FSH is follicular stimulating hormone, then your estrogen and your progesterone. These are the 4 hormones that will help a woman to become pregnant. Once you have problems in any of the 4, you have a problem. Okay? All right. Can a woman use vitamin E and folic acid without doctor's prescription? My sister, it's possible you are attending this clinic for the first time. Let me just make it very simple for you. What you need to do, depending on your location, find a reliable, very good pharmaceutical shop. Tell them to give you prenatal multivitamins. Prenatal multivitamins. That's what you need. Once you have it, read the label. Make sure it contains adequate quantity of folic acid and all the other important multivitamins. That's why it's called multivitamin. So once you have it, you don't need to take any extra because it's multi. It contains everything you need. So what you need to be on the lookout for is the quantity of folic acid in that prenatal multivitamin. Make sure it's at least 400 microgram. Once you have the 400 microgram, begin 3 months. Listen to me carefully. Some women waste a lot of time. Some women might not even know they are pregnant. And before you blink, you've already passed the first 3 months. The most important and the most critical period in pregnancy is the first 3 months, because that's when so many things happen. So if you are making love today and you want to be a mother, you might not know when you become pregnant. So you start taking your folic acid ahead of time. The critical period you're supposed to take your folic acid is 3 months before you become pregnant and 3 months into your pregnancy. That period of 60 days, very, very important. You can't get this wrong. Did I say 60 days? 90 days. So remember, 3 months. Approximately 3 months is 90 days, right? Then 3 months, 90 days. Very, very systematic. So by default, once you want to have a baby, start taking your prenatal multivitamins without wasting time. And you don't need prescription. Now, some women might need extra. If your doctor discovered you have a need for extra folic acid, it's going to give you extra folic acid. But if your doctor didn't find any need for folic acid, what you have over the counter is good enough. Okay? All right. So I'm going to take care of the last question, then we'll go for the evening. If someone has endometrium, I'm not going to make it complicated by taking care of values, because I don't have your full report. So it will be very, very unwise to advise you based on just one number you're throwing about. What I will tell you is this: take your result back to the doctor that requested it. Let's look at the range. Let's look at the lab. But be mindful. Very, very important. Anytime a provider sends you to a lab, take that result back to that same provider. There are different ranges in America here. I can tell you it's okay. Then we go back. We didn't know the criteria they use in doing that, and they might not be okay. So take it back to your provider, the person that requested it, okay? That's what you need to do, my sister. Okay. So if we don't have any other question, remember today's topic is on what? Your menstrual cycle and becoming pregnant fast. If you take time to study your body, if you take time to know your dates, if you take time to find a pattern, if you take time to know when you're likely going to ovulate, if you take time to know when you're likely going to be in fertility window, if you make love around the corner, if you exercise, if you avoid stress, before you blink, you're going to become pregnant. When you become pregnant, make it a point of duty to register for your ANC on time. Okay? When you do this, you're going to be among the League of Mothers in 2022. Okay? So thank you so much for coming this evening. Remember, before you go, click on the subscription button, set the notification so that anytime I come live, you will experience our teaching in real time. God bless you and enjoy the rest of your weekend. I see you guys actually tomorrow. So if you're in our group, I have my community health clinic tomorrow. We're going to talk about a very important topic. We're going to talk about Down syndrome. Then on Friday, we're going to talk about autism. Then on Sunday, before then on Saturday. So the next YouTube is going to be on Saturday. But join me in our clinic tomorrow for our community health clinic, and you will have every right to be happy. God bless you and enjoy the rest of your evening. Bye-bye for now.